I used to work as a medical scribe in a pediatric clinic. One day, a mother brought her daughter in, claiming the child was turning black. We were immediately concerned, wondering if it was some kind of infection or abuse. It turned out the child was simply tanning from playing outside in the sun. My best friend, who is currently a medical resident, had a patient with a festering wound on his face that was so severe it had maggots living in it. The patient didn't think it warranted attention until the maggots started falling into his cereal. I once treated a woman in her 50s who came to the ER complaining that she couldn't use her left hand. It turned out this was not a new problem. It had been an issue her entire life. She was right-handed. I'm a nurse. I once had a patient who had just had 2 toes amputated because of uncontrolled type 2 diabetes. They said, "My blood sugar is only high when I'm in the hospital." I asked, "Do you check it at home?" They replied, "No." I followed up, "Then how do you know?" The answer, "I just don't feel like it's high." I was speechless. Me, a dentist, to my patient, "Please stop using superglue to reattach your tooth." One of my patients crawled under his truck and leg pressed the engine back into place just 2 weeks after having a total hip replacement. He then came into the clinic complaining of pain. As a pediatrician, I encounter all sorts of things daily. I do have a lot of compassion, though, because when it's about your child, rational thinking often goes out the window. For instance, I frequently see families who bring their child to the emergency department for a fever of 99 degrees that resolves with Tylenol, waiting hours just to hear that their healthy child is fine. It's sad because of the time they waste and the stress they go through. However, more extreme cases involve naturopathic parents. These aren't anti-vaxxers, but parents of kids with severe chronic conditions like IBD or lupus who refuse conventional medicine. Instead, they opt for baking soda or other ineffective remedies while their children suffer, sometimes experiencing permanent damage. Jehovah's Witnesses frustrate me similarly, especially when their babies have serious congenital defects and the parents initially refuse life-saving surgeries unless they're bloodless. This leads to completely nonsensical conversations. I have a friend who works as a nutritionist at a hospital, and one story she told me has always stayed with me. A construction worker in his mid-30s suddenly collapsed at work, and his co-workers called an ambulance to rush him to the hospital. Once there, they found he was severely deficient in nearly every essential nutrient. My friend was brought in to assess his diet, and when she asked him about his eating habits, he said, "Well, I don't like having breakfast, and I don't enjoy eating and then going back to work, so I skip lunch. When I get home, my wife starts making dinner, so I drink beer. By the time dinner's ready, I don't feel like eating and just keep drinking beer before heading to bed." Essentially, this man was surviving entirely on beer and couldn't even recall the last time he ate real food. I'm not a doctor, but here's the most absurd thing a doctor ever said to me. I work as a microbiology lab technician in a hospital, and a fully licensed, board-certified doctor once asked me why I couldn't just put Petri dishes in the microwave to make bacteria grow faster so they could identify it and determine the right antibiotics. I couldn't believe it. I'm an optometrist in the US, and I've had a couple of unforgettable patients. One woman argued with me that urine eye drops had remarkable healing properties. When I asked her how she obtained these eye drops, she admitted she was scooping urine straight from the toilet and putting it into her eyes. Despite my warnings about the risk of bacterial keratitis, she didn't listen. I still dread the day she returns with a severe eye infection. Another common scenario: patients come to me months after taking a hard hit to the eye and losing vision. Twice in 3 years, I've had patients with total retinal detachments who thought they could walk it off instead of seeking treatment right away. If I had a nickel for each time that happened, I'd have 2 nickels. Not much, but it's odd that it occurred twice. I'm a lawyer, and once during a consultation, a potential client who'd been in a car accident told me she believed her brain was missing, literally thought it was gone from her head. Another time, a postal worker wanted to sue the post office because he'd been exposed to potentially toxic chemicals from a leaking package. When I asked him to describe the substance, he said it looked and smelled like honey. I then asked what the package looked like, and he replied, it was a can labeled honey. I work as a NICU nurse and once cared for premature triplets who eventually grew strong, healthy, and were discharged. It was a wonderful success story, until all three were readmitted weeks later. Their mother had brought one baby, Triplet A, to the hospital with dehydration and a fever. Tests revealed dangerous electrolyte imbalances that could have been fatal. The baby was hospitalized and treated with IV fluids and medications. We'd sent them home with a specialized formula for preemies to provide extra calories, as their mother's breast milk alone wasn't sufficient for triplets, which was entirely understandable. However, she stopped using the formula and replaced it with some raw goat or sheep milk product from Europe. Preemies' digestive systems cannot handle such products, and she was shocked when doctors explained this. She then brought in the other two triplets for testing, and their results were just as bad. All three ended up spending several days in the hospital on IV fluids and medications to prevent heart and kidney failure. This is a reminder for all parents. Only give infants breast milk or baby formula for the first 6 months of life. Nothing else. My mom, a doctor, once treated a diabetic patient who claimed she was allergic to water. Because of this, she only drank Coca-Cola. That case still stands out in my mind. I once had a patient come in, visibly distressed, because he'd found a box of dirty, used syringes on the street and injected himself with them. He was terrified about what he might have contracted. I reassured him that no matter the results, we'd figure out how to proceed. Miraculously, his tests came back negative for everything, and it was such a relief. At the same appointment, I suggested he get a tetanus shot. He looked me straight in the eye and refused, saying, "Vaccines are dangerous and kill people." It was a challenge to keep my composure in that moment. I'm an EMT, and we once got dispatched for a hand laceration with severe bleeding. Naturally, we rushed to the caller's home. When we arrived, we found a young woman, about 18 years old, clutching her hand and wincing in pain. Surprised at the lack of visible blood, I asked her to show me the injury. She pointed to a tiny cut, no larger than a centimeter. She explained that her family didn't have any bandages, and that she didn't want to risk an infection by going to the pharmacy to buy some. My mom had a patient, an elderly woman who was rushed to the ER after drinking bug spray. Once she was stabilized and admitted to a ward, my mom asked her why she did it. The woman's response? "I accidentally swallowed a cockroach, so I drank bug spray to kill it." We had a patient with recurring infected leg ulcers. Instead of cleaning and dressing them as instructed, she let her dog lick them clean. My ex-girlfriend, a paramedic, told me about a woman who regularly called for an ambulance. This woman, a germaphobe, swallowed razor blades encased in ice cubes, thinking it would destroy the germs inside her. Thankfully, her stomach acid usually dulled the blades, but still,